So let's just get right into it.
Sure.
So when how is it calculated how much money you're going to get? Because in the mortgage business, I'll do a loan out. One guy gets 1,000, one guy gets 2,000, one guy gets. How's that work?
Yeah, I mean, that's a really good question, and it's a pretty common question we get all the time. It's based on the years you work, right? So you have to pay in first.
Okay.
It's 10 years of paying Social Security wages. So they look at 40 quarters, right? They don't have to be consecutive.
It's the last 10 years?
10 years total. So as long as you work 10 years total, right? You qualify, For Social Security. Now, how they calculate it is.
All right, wait. You're saying if you don't work 10 years, then you don't get Social Security.
That's correct. You have to work 40 quarters paying Social Security wages. If you don't work 40 quarters, they don't have to be consecutive, but then you do not qualify.
Wow.
So make sure, first and foremost, work your 40 quarters, right? That's really important.
All right.
But the way they're calculated is a little confusing. They use the average of your 35 highest working years.
Okay.
So let me repeat that, right? So average, it's an average of your 35 highest working years. But if you don't have 35 average working years, they put a 0 in place of the years that you don't have 35.
Oh, that's not good.
And they still calculate a 35-year average. So as an example, when I was a young kid, my dad went to work. My mom stayed home with the kids. Dad had more working years than mom did. Mom had more zeros than dad.
So hers is lower.
Hers is going to be a lot lower, right? So that's how they calculate the benefit. Most people don't understand that.
All right, what else do we need to know about how much you're going to receive?
The longer you work, the higher your benefit's going to be. And conversely, if you work less years, the less your benefit's going to be.
Okay.
So it actually makes a lot of sense to be working a little bit longer because you start building up those average working years, those higher average working years.
So what's the maximum somebody could get? I mean, if one guy makes $1 million a year, is there a number where it maxes out?
So Steve, it's capped. Your wages are capped, right? For this year, your wages are capped at about $160,000.
So if you make more than that, you really don't get any bonus.
You make more than 160, you're capped at 160. That your benefit is capped out. So for a person who, let's say, is average 67 years old, full retirement age, your maximum benefit will be about $3,600 a month.
That's pretty good.
Yeah, it's pretty good. That's if you paid in the maximum.
If you maxed
out the entire time, about $3,600 a month.
All right, and then then let's move into when do you want to claim it? Because some people say early, some people say wait. So how do you coach people on when they take something?
So ideally, we do a lot of consulting with married couples, right? We always typically say the person who's the higher wage earner should probably take their benefits at full retirement age, right? Which is typically could be 65, 66, or 67. It's based on the year you were born. Okay. So it's important to understand that too.
How does that play in?
So full retirement age means you get your full benefits at full retirement age. So for example, my full retirement age is 67. If I wait to claim my benefits at 67, I get full benefits, no reductions, no restrictions, no penalties. However, if I took my benefits early, let's say at age 62, the earliest age you could take it, I get a 30% reduction in my benefits. And that's permanent over your lifetime. That's important.
All right, so if I'm going to sit down with a professional, what information does he want to figure out when my maximum, how I max the thing out?
So every year, what's interesting, you can go on onto www.ssa.gov. It's the government website. Uh-huh. You create yourself your own My Social Security account, and you literally can get your statement literally every year and go through your earnings.
So they already have my W-2s.
They have everything on there, but it's important. This is very important that you check to make sure it's accurate, because they're not going to tell you if there's something wrong or they misreported something.
Does that happen very much?
It happens a lot. It happens quite frequently.
Who does it mostly happen to? Is it a W-2 guy, self-employed
Pretty much
guy?
W-2 people, yeah. They'll misappropriate or they'll miscalculate it. Like for example, one year I was looking through my earnings and there was a year where it said zero earnings. And I said, well, I know I made earnings that year. I know it wasn't zero. So I called my CPA. We had a copy of our W-2. We had a copy of our tax return. We sent it in to Social Security. They immediately corrected it. But had I just let that go, then they would have used one of those years, that year in 0, to calculate my benefits. I would have got a lot less.
But it will tell you on that page what year is the best one
Absolutely.
for you to retire.
Yes, it will. Yeah.
Okay. So is 62 the earliest you can get your Social Security?
Yeah, it's the earliest age, but they'll tell you 3 years that are on your statement. 62, full retirement age, whether that's 65, 66, or 67, or you can wait till 70. Now, that's interesting because if you wait till 70, your benefits grow about 8% a year up to age 70, plus any cost of living adjustment. Now, if you're older than 70, there's no benefit in waiting until after 70 to take
So
your
everybody should take it.
Everybody should take it at least until when they get 70,
Okay.
right? So if you're looking to maximize your benefits, ideally, 70 is the age where you want to maximize your benefits, but you also have to take into consideration longevity, your health history, your family history. There's a lot of factors that go into that. If somebody just took their benefits at 62, they're giving up about 30% over their lifetime.
Okay.
You know, so there's a reason why some people might want to take it at 62. If you're single and you're not married, maybe you want to take it early instead of taking it later. If your health history warrants, you don't have anybody in your family that's lived a long time, maybe you want to take it early at 60. You might not get it. You might not get it later. So there's a lot of factors, but you got to keep into consideration. If you take your benefits early and you're married, you're also hurting your spouse too. As I'll give you an example. Let's say my benefit was $2,000 at full retirement age, but $1,500 at age 62. And I decided to take it at 62, and then my wife doesn't have enough earnings, so she wants to take benefits off of me, spousal benefits off of me. I've just hurt her over my lifetime, because if something were to happen to me and I die, my wife gets the benefit of stepping up to my benefits.
All right, so explain stepping up to your benefit with a spouse.
Sure. So if you're married and one person passes away, then you have the option of stepping up to the higher benefit, but you lose the lesser benefit. So you can only
you get to pick one of the two.
The higher check. You pick the higher check. But if I've taken my benefits early at age 62, I've reduced that amount, and if I pass away, women live longer than men. I've just hurt my wife, meaning she's going to get less money and outlive me.
So the average couple, if the one that's making the most money needs to hold out as long as they can?
They should.
Okay.
But again, it all depends on how much income they need. Do they need that income right away? That's why we always say, don't just make a haste decision. Talk to a consultant, talk to a financial advisor, have a plan of what you want to do and how much income you're going to need, because it's not just simple turning it on.
Okay, now when I do a loan, it'll say taxable and non-taxable.
Right.
What does that mean?
So
on your tax return.
Yeah, so taxable and non-taxable. About 40 to 50% of the people that collect benefits today, their benefits are taxed. Now, you might say, well, I thought we were taxed already when we earned them.
We were.
You were. You're also taxed when you start receiving them too. So you might say that that's double taxation, and
right.
That really is how it works. It's based on your income level. So what they do is when you retire and take your Social Security, they look at what your income level is, and you have to stay within a certain bracket. If you go over that number, then they can tax your benefits up to 50%, sometimes up to 85% on your benefits.
So is there a maximum amount that you can earn in order to receive the full Social Security?
Yeah, so I'll give you an example, married filing jointly. Okay. If you were to keep your income, they call it provisional income. What that really means, simplify it, it means they take half of your Social Security benefits, they add all of your sources of income, including farm income, rental income, dividend income, capital gains, any income from your municipal bonds. They add up all your sources of income, plus half your Social Security, and you have to stay within a certain level of income. So for example, if you exceed $33,000 of income, then up to 50% of your Social Security benefits are taxed at the ordinary income rate. Okay. If you go over $44,000 of income, up to 85% of your benefits are taxed at the ordinary income rate.
And then what's the minimum that you don't get taxed?
The minimum is 30. If you keep your income under $33,000.
So that's why you see a lot of retired people saying, "I'm
Sure.
going to work 2 hours."
Yeah, they don't
this
want to
week."
work. Yeah, they don't want to have a lot of income come in.
They're trying to stay under 33.
But Steve, sometimes it's hard to avoid. If you have a 401k at work, or you have other sources of income, you have a business, you have rental income. Sometimes it's hard to avoid having that income come into your household in retirement.
It's not household income; it's individual.
It's individual income, right? But if you're married filing jointly and you're filing a joint return, they look at joint income.
Oh, they do.
Yeah.
So joint income can't be over 30.
That's correct. Yeah.
Oh,
and think about how low that is. That's only about
yes,
$3,000 a month.
Yeah, that's not much.
When you think about it. So most people, that's a surprise for most people when they start collecting Social Security, that their benefits are taxed. And the best source of that is go to your CPA, your accountant. If you do your own taxes, make sure you're keeping track of that, because they will tax your benefits.
Okay. All right. And then what about if you're married and you get divorced?
Yeah, I have a funny story about that too. I was out in Myrtle Beach about six weeks ago, and we were doing a workshop, and this woman, Mary, she's about 59 years old. She comes up to me and she says, "Can you explain? I'm divorced. I was married to a former CEO of a major tire company, and he got remarried, and I'm living with my boyfriend, Ed, and he's running his own construction business, but we're living together. Can you explain how that works?" I said, "It's very easy. If you're divorced, they use the 10 and 2 rule. I like to think, Steve, when we learned how to drive, we put our hands on the wheel at 10 and 2, right?
Right.
So it says married for 10 years, divorced for 2. So the rule of divorce is you have to be married for at least 10 years, divorced for 2. If you are...
To that guy.
To that guy,
Or
right?
girl.
Yeah, to that person that you divorced, okay? If that's the case, then you can start collecting benefits on that person as early as age 62, and they don't even have to know about it. You just walk into Social Security, you file the paperwork,
Wow.
and you can start. Now, here's the funny story. Mary says to me, I'm 59. She says, "Are you telling me at age 62 that I can start collecting benefits off of my ex-husband?" And I said, "Yes, as long as you stay single, because the rule says you have to stay unmarried."
Oh.
So I'm talking to Mary, and Ed says, "Well, I thought we were getting married." And she said, "Not anymore." So
in that scenario, if her ex got, what would you say, it was $3,000 a month?
yeah, $3,600.
How much would she get?
If she waited till full retirement
Yeah.
age, she gets that full $3,600.
So that's 70 or whatever. Her
Right, or
max
she'll
is.
get half of that, the spousal benefit. So she'll get half of that.
She gets half of his
Half of
number.
his full retirement age number, yeah.
That's a good little number.
Of course it is, yeah. Which is, by the way, we joke, but it's why most people, don't get married older in life, right? They start living together, because once they get married, remember, once they get married,
It's household
that 10-year
income.
clock starts all over again, right? Married for 10 years, divorced for 2. So a lot of people live together and collect benefits off their ex-spouse. It's pretty smart.
Yeah.
For a lot
So is there a
different.
Social Security local one in most communities or whatever major town?
In most communities, here in Atlanta, it's probably in downtown Atlanta, but
Right.
you might have a few, Marietta or
you
Alpharetta.
could get an
some-
appointment or something.
You make an appointment with a Social Security administrator. That would be the best thing to do. Sit down and go through your situation with them, or talk to a consultant or advisor.
All right. How about Medicare?
Medicare is interesting because you qualify for Medicare when you're age 65, but your enrollment period is a 7-month enrollment period. So you can enroll anytime 3 months before your 65th birthday, the month of, and 3 months after your 65th birthday. So it's 7 months of the enrollment period. You don't want to miss that enrollment period, because if you miss that enrollment
You gotta wait
period,
a year?
you got to wait another whole year before you do it, and there could be penalties because you didn't sign up when you should have signed up, and they could assess penalties to you. So Medicare, I like to always say it's the ABCDs of Medicare. We learned the ABCs. A is hospitalization, B is medical insurance, C is Medicare Advantage, depending on your state, and D is prescription drugs. So if you just remember that, A, hospital, B, medical insurance, C, Medicare Advantage, and then D, prescription drugs.
All right. So 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 when you get Medicare, then you don't have to have your own. Is that part of the Obamacare or?
Nope, it's not part of Obamacare.
It's a separate thing.
It's separate completely. But
that's all you need.
But there's original Medicare and there's Medicare Advantage. Now the distinction between the two is that original Medicare, think of it as a la carte. You're kind of picking and choosing what the parts that you want.
Okay.
Medicare Advantage is a bundle, what we call a bundled plan, meaning all of those parts are bundled together and you're paying one premium.
So what are the
for
different
that bundle
parts?
plans? So the different parts again are A, B, A and B,
okay.
right? So part A, part B, and part D.
So why would I want in hospital?
Well, a couple things. If you want to reduce sometimes people want to reduce their cost of what they're paying.
Yeah.
So they want to go to Medicare Advantage. It could be a little bit less costly than doing the a la carte, but there are some advantages and disadvantages. The disadvantages are you have to stay within their network of doctors. So, my father is an example. He's got heart disease and diabetes, and he's got issues there with Parkinson's. If he has a specialty doctor or specialist, he might not be able to go to that doctor if he's on Medicare Advantage. You have to stay within their network.
Okay. So he does a la carte.
Right. So a la carte.
But I guess I guess what I'm struggling with is why wouldn't you pick all of them?
Most people do. Most people do. 75% to 80% of people pick Medicare, the original Medicare a la carte.
Okay.
Right? So it's based on your income. Your premiums are based on your income. So they look at what your filing is. Now, this is important. Every year they do a look back on your income. They do a 2-year look back on your income every single year. So if there was 1 year, Steve, that you and your wife made a lot of money that year and you went through the brackets, your premiums could be a lot higher that year, that next year. They have the ability to raise your premiums.
It's a 2-year average or the most recent average?
Every year they do a 2-year look back. So this year's 2023, they would look back at 2021 income in 2021. That's right.
So what's the max somebody pays for that?
The maximum can be anywhere up to over $580 just for Part B. For Part B, your medical insurance. Part D can be anywhere around $120 maximum.
That still sounds like it's not much more.
That's $700 a month per person.
Yeah, that's
so if you're married, that's $1,400 just for medical insurance. We're not even including your co-pays, your co-deductibles, your co-insurance.
All right, let's talk
any
about
out of pocket. Let's talk about that. It's important.
Co-pay. So is there always a co-pay with Medicare?
Always a co-pay with Medicare. Yep.
And it depends on what you're doing.
Yep, it depends. Part A and Part B have co-pays.
$50, $25, $100.
It's about $280 a year for Part B. For Part A for hospitalization. I don't have the numbers off the top of my head. It's about $150 for a copay.
Pharmacy?
Out of pocket. Pharmacy, they only pay up to a certain amount, and then there's something called the donut hole, and you might have heard that. It's kind of interesting. You get to a certain point where they only pay so much, and then they have a donut hole. A donut hole means once you reach that level of payment, then you're out of pocket for a certain amount of your prescription drugs until you reach another level of payment, and then there's another copay. So prescription drugs are interesting because it depends. If you're healthy, it's not an issue. If you're not healthy and you're on several prescription drugs, it can be very costly to you. You're on blood pressure medication or anything else, it could be pretty costly over time.
And I guess you'd want to try to get generics on as much of that as you could.
You could, but sometimes you can't take generics. My father couldn't take generic drugs. He needed a certain prescription, and it's pretty costly in retirement. I mean, that's when we talk about Medicare and the cost of living. You talk about inflation today, prescription drugs are going up by 15 to 20% a year in the cost of prescription drugs alone. So stay healthy, exercise and stay healthy.
So there's certain places that, I guess there are certain doctors that can say we don't take Medicare, just like I don't take somebody else's.
Not typically, Steve. Most doctors today have to take Medicare.
Hospitals
are required to. Most hospitals do, yeah.
So they might take Medicare.
I mean, unless you're going to a private doctor and he says completely, hands off.
No insurance.
But there's some rules today that preclude that from happening. They have to take, a certain number of Medicare patients.
What kind of rules on that?
Well, once they get to let's say you have a private doctor that only wants to have a certain number of patients, then he can take a certain number of Medicare patients compared to the total number.
So the doctors, do they like the Medicare, or they think it's too cheap for what they do?
I'm not sure if they like it or not, but they have to, they have to adhere to the system. Most people are on Medicare, especially, when you reach 65 and older.
So you tell everybody when they get to 65 they need to do that?
Most doctors make more money on prescription drugs probably than they do on Medicare, So, but yeah, we tell people, when they're older to, go on to Medicare. I mean that's probably the most efficient way that they can manage their health and their health expenses. The one struggle that we find, Steve, the challenge we find is that most people don't know how much it's going to cost. They underestimate the cost of Medicare and the cost of medical.
So it sounds to me like it's $1,000 to $2,000 a month.
Yeah, and for an average healthy 65-year-old couple, it could be anywhere between $7,500 and about $7,500
a year.
Yeah, so it could be pretty costly to them, and depending on how healthy they are.
Yeah. So if a guy's still working and he works for an IBM or something like that, does he want to stay with that insurance or go to Medicare?
Well, most of the time your insurance supersedes, a Medicare insurance, right? You have a good hospital plan at your work. You're better off with your hospital plan at work than you are with Medicare.
But do you still need to file anyway for Medicare?
You file for Part A. Part A is, we call it free, but you've been paying for Part A out of your paycheck for a long time. So when you turn 65, if you still have insurance with your company, you apply for Part A. You don't have to apply for Part B or Part D, but Part A is hospitalization. What I meant by supersede is, in most cases, you sign up for Medicare Part A. Most of the time, company hospital plans are much better. They provide better coverage than what Medicare is going to provide when you're working.
So you work with a lot of financial advisors.
I do.
Yeah.
Yep.
So if you had some person, a neighbor or somebody, says, "Hey, I need a good financial advisor," what kind of questions would you ask them to try to figure out who you would put them with? What do you think are the key things that?
Well, first and foremost, I would say if I was consulting with, let's say, a client looking for a financial advisor, you want to ask your financial advisor, what they know about Social Security. Do they have any planning tools to help plan for Social Security, when you're going to take it, what the differences are in taking it from 62 to full retirement age. There's a lot of different calculators today, Steve, that financial advisors can use.
They should have that.
They should have access to that. And then secondly, you don't have to be an expert necessarily on Social Security and Medicare. There are specialists.
They can call you.
Right, they can call me, or there's specialists that write Medicare out there, healthcare consultants that write it out there. But they have to have a working knowledge of Social Security.
So does your normal
Medicare.
financial advisor, is he going to write that Medicare thing, or is he going to send you to somebody
Most
else?
of them are not going to write it individually.
They're going to send you to like a guy that sells health.
Send you to a Medicare, like either write Medicare supplements, or to a healthcare consultant who's local in their area who's going to write health insurance for that person. But they have to have a working knowledge. I think the biggest challenge that I find is that most financial advisors don't have a working knowledge of Social Security and Medicare, which is why we created our company, to help advisors learn a little bit more about it and navigate through it.
So if somebody out there has an advisor, they can give them your name and number, and the advisor can
Absolutely.
call you and you can consult with. Hey, call your guy.
Absolutely, yeah.
All right, so you spent some time selling annuities.
Yes, sir.
So, I see on TV, this one guy says, don't ever buy an annuity or whatever. So what would you tell people about annuity? When's it good, when's it not?
Well, Steve, I think the interesting thing is that if you define what an annuity is, typically annuities are guaranteed sources of lifetime income. So if you just simplify that for a second.
Annual.
It's annual, monthly, quarterly. That's what annuities are designed to do. Annuities are designed for growth, but they're also designed for income, and most people need an annuity. Now, if you think about it, what's Social Security?
An annuity.
It's an annuity. What's a pension?
Annuity.
It's an annuity. So, you like annuities.
You can create
right?
your
own.
own.
You want to create your own.
Yeah.
So an annuity is just creating your own source of guaranteed income to supplement Social Security.
Who's the best person for annuities? Is there any particular class of person that?
Typically in my experience, the best person for an annuity, and I'm just generalizing here,
Right.
is maybe somebody who doesn't have a pension. right? Who
Okay.
works,
Like me.
yeah, might not have a pension, might be self-employed or might not have a pension,
Okay.
might have a certain amount of retirement savings built up. Social Security was never designed to be your only source of income when you retire. It even states that on your statement.
And
It was
and
never
it is.
designed to be your only source, yet it is for most people. So I think annuities are designed to supplement your existing retirement plan,
So
whatever
how
that
does
may
an
be.
annuity work? I mean, how do you put in X amount of money and you get X amount of money? I mean, how's that? How would you? What's the ABC easy?
Well, Steve, you're in the home business. It's the same way that insurance works on the homeowner side and on the auto. All you're doing is transferring risk. When you buy an annuity, you're transferring risk to that insurance company, right? The risk of either living too long or running out of money,
Okay.
right? So those are two risks that I think are pretty real for a lot of people today.
Right.
So the risk of buying homeowners insurance is that something happens to your house, or buying auto insurance is that you get into a car wreck and
Right.
you
Or
you hurt somebody or whatever.
Have a wreck or a fire.
Right. So if you think about the everyday things that you and I do, we transfer risk every day when we buy auto insurance or homeowners insurance. Buying an annuity simply is using it for a purpose. Typically it's for retirement, and transferring that risk to the insurance company, letting them take on that risk and providing some type of benefit back to you. And that's the way I look at it.
So on your Medicare, does your Medicare get taken out of your Social Security check?
Yeah, Steve, that's a really good question. So most people don't understand that if you're collecting Social Security and you're on Medicare, your Part B premium for your medical insurance automatically gets deducted out of your Social Security check. A does not.
Just
Remember, there's no cost for A unless you're in the hospital. Then there's a cost. If you never use Part A, then there's no cost for Part A.
Oh.
Okay? You've already paid for Part A through your paycheck. When you pay your Medicare tax out of your
But
paycheck,
if I go to the hospital,
you're
that's
going
it's
to
gonna
pay a
be picked up.
copay. You're going to pay a copay
A
automatically.
Part A copay.
Part A copay, right? Automatically, and then they're going to charge you a per day, per diem, per day for as long as you stay in that hospital. Now remember,
And that's it.
it's really only for overnight stays, right? So an overnight stay is considered 2 overnights. So if you're in there just for observation, they might observe you and then send you home that day. That's not considered an overnight stay.
What if I'm there for a month?
Well, then you're going to pay an awful lot of money through Medicare Part A hospitalization. It could be upwards to $10,000 for a 90-day stay or 60 or 90-day stay.
Oh, so they're gonna pay the first 2 nights, and then you're paying their rate.
And then you're
for the
paying a
rest of
per
it.
day
Okay.
for as long as you stay in that
How
hospital.
much is that? Is it?
It just depends on
$100
how long you're staying in there. There's brackets if you stay there from 0 to 30 days, 30 to 60 days, 60 to 90 days. But it can be pretty costly over
And the
time.
Part B is what?
Part B is based on your income.
But that's called what?
Is medical insurance.
Medical. Okay.
That's
so,
for your normal everyday going to the doctor, getting a checkup.
Okay.
Any well visits.
and that comes out of your Social Security.
That comes out directly out of your Social Security check. You
I
don't have a
think
choice.
I see that on your Social Security statement.
Yes,
right?
sir, and you don't have a choice there.
Yes,
It automatically reduces it.
right.
So that's why we always say that Social Security is a declining lifetime income. It is declining. You think about Social Security, you take a steady check, it's declining over time because every month your check's being reduced by your Part B medical premium.
Oh, okay.
So it's important to complement that. We talked about annuities before. It's important to complement Social Security with your own annuity. Build your own annuity to complement that
Gotcha.
for those expenses. But yeah, those are really good questions. I mean, those are very common questions we get from a lot of individuals. When to take their Social Security, what age to take it, will it be taxed, what happens if my spouse passes away? We get a lot of those questions. Steve, a common mistake I think a lot of people make is they'll take their Social Security benefits early. Now, remember what we said about early. Early is prior to your full retirement age.
Okay.
So if you take your benefits early, you're getting a reduction in your benefits.
Okay.
But we find that a lot of people will just go back to work. And so I'll give you a great example. My neighbor Bob retired recently from Duke Energy. He's 60 years old. Retired from Duke Energy, and he took a buyout and everything. And we're having a beer in the backyard, and I said, Bob, what are your next plans? And he said, you know, you're not going to believe this, but Duke called me and said they offered me a consulting gig, paying me about $60,000 a year to work 3 or 4 days a week out of my house. I said, that sounds great. I said, what else are you going to do? Are you going to retire? What about Social Security? And he said, you know, Mary and I were thinking about this, and I think we're going to take it at 62 because, we could use that money right now for vacations and see the grandkids and do a lot of that. And I said, well, Bob, if you take your benefits early at age 62 and you work, they're going to reduce your benefits. Let me explain. They use Social Security uses something called a retirement earnings test, which means if you retire early, take your benefits early, and you continue to work, they only allow you to make a certain amount of money before they start reducing your benefits. The limit this year is $21,240. Now, here's how this works. It's a little crazy. For every $2 you make above that limit, they will reduce your Social Security benefits by $1.
Whoa.
So for every $2 you make over $21,000, they will reduce your benefits by $1. And they will do that up until your full retirement age. So think about Bob for a second. Bob's going to take that consulting gig making $60,000 a year. He's $40,000 over the limit. So for every $2 you're over, you're going to reduce your benefits by $1.
He's wiping it out.
They're going to wipe out his benefits by about $20,000. Now, he's going to take his benefits at 62. We did a quick calculation on how much income he's going to have over that period of time, and he's only going to have $22,000 of Social Security income. That means $20,000 is going to reduce that $22,000.
Now, does he get it back when he quits taking the 60?
Yeah, now here's the interesting thing. If he were just to wait until his full retirement age, which is 66, then he can make as much money as he wants with no reduction. So we tried to consult with Bob and Mary and say, do you really need to take your Social Security at 62?
Was that beer or bourbon or what were you using? That was
beer. I should have used bourbon, but probably beer. But I tried to tell him, instead of taking it at 62, just wait an extra 4 years and take it at 66.
It's
and then
money.
you can work for Duke and make as much money as you want and not have your benefits reduced. But Steve, that's pretty common. A lot of people don't understand that they go back to work and they make too much money.
That's a huge
and they have their benefits reduced.
Yeah.
Why would you do that? Why would you give those benefits up? So that's a common mistake.
Because they think they're going to quit
Social
Security,
they think they're going to quit. Yeah.
So what's the politics on Social Security? Where do you think it's headed?
Well, what's interesting about that is they're still using calculations from the 1980s, 1990s. They haven't adjusted any of those calculations. They're still using, for example, from your full retirement age to age 70, you get a guaranteed 8% increase in your benefits from full retirement age to age 70. Guaranteed 8% increase in your benefits every year.
Market.
That's better than what the market is doing right now. If you could get 8% on your 401k or your retirement plan, Steve, you would take that all day long.
Be happy.
Right? And you get the cost of living adjustment on top of that.
Which is
you think about
1 or 2%.
This year it's 8.7% cost of living adjustment.
So that's 16%.
That means if I wait just 1 year from 67 to 68, if I'm 67 right now and I wait till next year till I'm 68, I'm going to get a 16% guaranteed increase in my benefits. Why would I not do that? I mean, unless my health was really bad and I really needed the income, my investments aren't going to do that good. So those are the little things I think that, there's a lot of complexities in Social Security that need someone to walk them through and help them navigate through. The average person doesn't understand all the complexities. And I don't mean that in a mean-spirited way. I just mean that, we're not taught Social Security and Medicare. We learn it from our friends, our neighbors, the people we trust, our other professionals that are out there, but you need an expert to help you guide through that.
So if anybody's watching and you're a financial advisor and you need a good consultant to help you on Social Security and Medicare, Dr. Soos is your doctor.
Call me anytime.
All right. Hey, we appreciate y'all staying tuned in for another beach talk, and we hope to see you next time. Thank you, my buddy.
Steve, thanks. Appreciate it. Pleasure.